Hello, and thank you very much for joining us today. My name's Deborah Garlick from Henpicked, and this session is Menopause and Sex, Part 2. I'm absolutely delighted today to welcome back to the session Dr. Claire Macaulay. And I say welcome back because we had such an amazing session last time and so many questions. Clearly, sex is very important to us and we want to know all about it. And Dr. Claire Macaulay is, I would say, passionate about helping us all understand and achieve our sexual expression, the one that's right for us. Is that right, Dr. Macaulay? Not the one that's for anybody else. You know, not everyone wants to be swinging from chandeliers or whatever it is. So I think that is what's particularly different about you, helping us achieve the best sex life for us. So welcome back.
Thank you so much for having me, Deborah. I'm delighted to be back. And yeah, I think that's really, really key, is that our sexual expression is ours. We get to choose what we do with it. We're subjected to a lot of things out there that tell us what it should look like. But frankly, I think we're done at this age doing things that we think we should be doing. Why don't we figure out what we really want to be doing or would like to be doing and do that? And whatever that looks like is absolutely fine.
Absolutely. And we're relying on you to help us understand what it is that we can do to achieve that. Because there's quite a few myths. And before we came on this session today, we talked about a few of them. So can we just recap what's going on in our bodies? And as somebody was saying to me the other day, why is it I just don't feel like it anymore?
Yeah, absolutely. Well, what I thought I would do is, you might remember, I think I had this the last time, I bring Verity, my velvet vulva puppet, everywhere. Look, she's actually a puppet. Look, let's have a look. She actually does things. So maybe what we start with is what's happening in our pants. That's not what's happening in all of us, but this is a part that maybe we can begin to understand. So as we begin to lose the estrogen part of the hormones that we produce when we are fertile and menstruating and cycling and all those kind of things, as we start to get to perimenopause and menopause and that begins to wear off, all of these tissues, so these are our outer labia, so these are our outer lips that are usually covered with hair, our inner lips or inner labia, this is the clitoral hood, that's a little hood that sits over the clitoris here, and then into the urethra, that's where we pee out of, and then into the vagina itself here and the G-spot at the front. All of these tissues and the tissues that sit behind them in the pelvis, so the bladder and the connecting tube between the bladder and the urethra and the outside, and our pelvic floor muscles that hold all of this in place, they're all reliant on estrogen. So as the estrogen begins to fall off, and we know this because we experience it in other things, people might experience other symptoms, hot flushes, skin dryness, eye dryness, also all of our tissues in our body are reliant on estrogen, these ones in particular. But as the estrogen begins to fall off, these tissues begin to not work in the same way that they did before because they're reliant on estrogen to keep them in tip-top condition. So as the estrogen begins to fall out, we can start to lose tissue here. So we can start to actually lose some of the erectile tissue that swells with blood when we become aroused. We can begin to have difficulties with our urinary symptoms, so bladder and the external urethra here in terms of peeing, in terms of continence issues, pelvic floor issues, pelvic floor can become weaker. We can lose sensation, so we can lose sensation in our clitoris and in this whole area in particular. And also we can lose the ability to secrete vaginally when we become aroused, so we're less wet. So a lot of people discover that they are experiencing vaginal dryness, which for many people, when they look back, when they start to realize that this is what's happening to them, they actually are able to, this is one of the most sensitive barometers of our estrogen. So actually sometimes, and that was my experience, I realized I got a few months down the line and I thought, oh, that's what that was. So quite often I will hear women saying that they have repeatedly treated themselves for thrush because they've had some kind of itching or burning sensation. And it's not making any difference. And often when we look back, we can see that people have had some of these symptoms early on. So that's what's going on physiologically. It is real. I think that's the other thing to say to people. You're not making it up. It's not, you know, it's not in your imagination. Your falling levels of estrogen are having an effect on your body, almost definitely. So it is real. And that's the first thing I think to reassure people.
Yeah, and if I've got a look of horror on my face, Claire, it's because
you don't like my velvet vulva, is that what you're saying?
And for anybody listening into this, Claire's holding up her hand puppet, and it's a very plump cushion. So mentally, that is where, you know, that is the ideal, as you say, when we're in our fertile years. But the look of horror I had on my face when you started to say shrivel up, it was like, whoa, really? Is that going to happen?
So it has a name of its own. So we now call it the genitourinary syndrome of menopause, and that takes in the genitals and the urinary system. But the term they used before that, and a term that's still often used, is called vaginal atrophy. And atrophy means dying off. That's what it actually means. So we describe it as physiologically as a dying off of the tissues. So a bit like, for example, when you have been going to the gym a lot and you've been doing a lot of, let's say you've been doing a lot of bicep curls, when you stop doing them, those muscles atrophy, so they begin to die away. And the same thing happens to our genital structures when we don't have any estrogen on board, or when the estrogen is beginning to fall off, is probably a better way to describe it. So yes, they do begin to recede, and some women will notice that their labia don't appear to be there anymore, or their clitoris appears to have shrunk. So it is real. That level of atrophy doesn't necessarily happen for everyone, but it is a real thing, and it does really happen.
It does. And as I said earlier, that a woman was saying to me the other day, if men's bits shriveled up, there'd be something that would be done about this. And my response was, I think that's called Viagra, because that is what men can experience. But it's interesting you say it's not just in our heads. This was new to me when I first heard this, and I was horrified. And every time we talk about it, I still feel a bit like, when you talk about vaginal atrophy, I'm sorry, but that doesn't sound very sexy, does it?
It absolutely doesn't. And I think one of the reasons that I'm so keen to talk about it is because for many of the symptoms of menopause, so the hot flushes and all things, there may be an end to that. So often people will experience quite a turbulent time through the perimenopause and early menopausal years, and then it will settle. So the anxiety and the flushes and all those kind of things will settle. There'll be a kind of great element of peace and all those sort of things. What we know is that if you've got vaginal atrophy, that doesn't get better with time. In fact, if anything, it's probably likely to get worse. So the reason that I talk about it a lot is so that people can be aware of it, because there are things that we can do to prevent additional loss of tissue, to prevent vaginal dryness, to just make fannies feel a bit happier, to be quite honest. That's how I see it. As I think about it, it's an element of self-care, and it's about going, okay, what do I want to do with my body at this phase of my life? Is this something that I want to tolerate and put up with, or is there something that I want to do about it? And there are definitely medical treatments, aspects, things that you can try that can make things better.
What might they be?
Okay, so there are different aspects. Essentially, this is a hormonal problem. So if we're just talking libido and sex and all the rest of it's a much bigger issue than just what's in our pants. But if we're just talking about the aspects of what's happening in our pants, so vaginal dryness, loss of sensation, loss of tissue, because these symptoms are a consequence of falling estrogen, we can use estrogen to treat them. So that might be for women who choose to use HRT, that may improve their genital symptoms. But we know that for people who use HRT, so say that's patches or tablets or gels, so they're using HRT for all of them, even for them, about 25% of women will still have problems with vaginal dryness, for example, while they're taking HRT. So there are other ways to use to deal with dryness and difficulties. There are non-hormonal methods. So we can use vaginal moisturizers. So you can get actual moisturizers designed for your vagina, which you can get on prescription if you have vaginal atrophy, or you can buy over the counter. You can also incorporate moisturizing your vagina with something like coconut oil or something very neutral that doesn't cause you any problems. Moisturizing your labia, moisturizing just generally in your kind of perineal area, without any medical products, and just including it as part of your self-care. So there's those non-hormonal things, but then we can also use vaginal estrogen, so using estrogen within the vagina. So that comes either as pessaries, so tablets that you can put in the vagina, as creams, or as a ring pessary, which is a ring that goes in and stays in, that secretes a small amount of estrogen all the time. And even if women choose not to have full HRT, so HRT that's either patches or creams, patches or gels or tablets that's going to work for all of them, you can use estrogen locally just in the vagina on its own if they are the symptoms they're experiencing. So, you know, the world is becoming very polarized around HRT or not HRT, but there are subtleties within that you can use estrogen in particular ways to deal with the genitourinary syndrome of menopause, even if you don't want to use HRT.
So whether you're using HRT or not, a local HRT is still something that you can consider because it's not systemic.
Yes, so we know that very little of what we use in the vagina locally, because of course, because that's the area we want it to get to, we can use very low doses because you're using it directly on the tissues that need it. And there's a very, very low absorption of that estrogen into the rest of your body. So for example, even people who may have been told that they can't have HRT, I think that needs a wee bit of further exploration. If someone's been told they can't have, I think you really need to know why you can't have it. But even if you've been told you can't have systemic HRT, so that's for all of you, you may well still be able to use vaginal estrogens if you have symptoms such as vaginal dryness, loss of sensation, loss of orgasm, incontinence, issues around, some people feel that they've got a kind of constant urinary tract infection. So people might find that they've had repeated episodes of being given antibiotics, but actually there's not an infection. So all of those symptoms may be helped by using vaginal estrogens.
Fabulous. So you're explaining a lot about the physical side.
Yeah.
I guess the sort of the big question we're often asked is, so where do I get this testosterone then? Because that is one that so many people say testosterone boosts your sex drive, so that's going to be the solution.
Yeah, so the making sure that women understand the physical bits and bobs is one thing, but that's not really where my passion lies. My passion lies for what does it mean to be a sexual human? What does it mean to be a sensual being? Because we are sensual beings, we have senses, that those senses can bring us immense pleasure. So actually, the medical factual side of it is one thing, but how you want to be in touch with what your sexuality means for you, your sensuality, what pleasure you can experience in your body, isn't necessarily going to be fixed, if you like, or necessarily even impacted in altering your hormones if you don't like your body very much, or you're in a bit of a crappy relationship, or you're very stressed at work, or all of the other things that impact how in touch with ourselves we feel and how in touch with our bodies we feel. So that it's a different thing, you know, slapping on some HRT isn't necessarily going to fix all of those other issues that might be impacting on how you want to express yourself sexually.
So testosterone may not be the magic cream.
I think there is some evidence for testosterone, but that evidence is not particularly strong. And what I see is women bitterly disappointed having tried testosterone, that it's not really made an awful lot of difference to them. And then they tell me, yeah, and actually I've not been having sex with my partner for 6 years. And I'm kind of going, well, the fact that testosterone is never going to deal with the fact that you've got some issues within your relationship. Testosterone is not going to deal with the fact that you're stressed and you're tired and you know, you've got elderly parents to look after, and testosterone is not going to change how you feel about yourself and your body. Testosterone is not going to provide you the sex education that you need at this point in your life to have the experiences that you want to have. So yes, there is evidence for testosterone. I'm not saying that there isn't, but what I'm saying is having a fulfilling sexual life is not all about whether your hormones are in balance or not. It's so much more than that. But the interesting part of that is it's really fun to find out. It's really fun to find out, and actually if that's what we want, then for me it's about becoming a bit of an explorer, exploring what is it actually that I want now at this time in my life. What do I want to experience? What do I want my body to experience? How much pleasure am I allowed to have? How much pleasure am I going to allow myself to have? So there's lots of bigger questions, I think, rather than just should I have testosterone.
They're great questions as well, aren't they? Because actually asking yourself rather than assuming that you've got to achieve some sort of norm. Obviously, you know, it depends on you and your partner in this. But
and I think one of the other things, and you know, I'm not always hugely popular for saying this, but I'm going to say it anyway, which is that I think as heterosexual women, we are somehow conditioned to think that pleasure is something else that someone gives to us. So that's what we see. That's how it's socially conditioned within us. But actually, and what I'm saying is, what would happen if we took responsibility for that pleasure for ourselves? What if actually we are capable ourselves of determining what our levels of pleasure are, how we want to interact, what we want to achieve with our bodies, rather than relying on someone else to give it to us. And there's a big piece there about turning the lens inwards and going, okay, well, what do I want? Because the vast majority of people who come to see me and I say to them, what do I want? They don't know what they want. They know what they don't want often, but they often don't know what they do want. And they're kind of expecting someone else to figure it out and give them what they want, even though they don't know what it is themselves. So a lot of the work that I do is about unpicking what messages did you get? Who gave you those messages? Do those messages still, those beliefs that you have around sex and sexuality and what it means to be a sexual being, do they still serve you at this point in your life? Do you want to examine them? Do you want to think about whether that's true? And if it isn't true, what do you want to do about it? So there's a lot of work, I would say. There's a lot of unpicking to be done if you want to have a sex life that is really meaningful for you, rather than doing things that you think someone else wants, which I see very often. I'm coming to you because I need to be fixed, because him, if they're in a heterosexual relation, I need to be able to do this for my partner. And that's kind of slightly heartbreaking, you know. I think especially when you know what is possible if we allow ourselves to open up to the possibility of pleasure in our lives and what that might mean for us.
All really great questions. But as you say, you know, this is a time in our lives when there is so much else going on. And I can see there are so many questions coming in. So I'll probably see if Sally, training director at Henpicked, is available to answer or to ask some of those questions, Sally.
Absolutely.
It does look like you're having a busy time in the background there with all of the questions.
Yeah, definitely started typing a few responses in, but we'll start working through these because he has some really, really great questions coming in. So some quite kind of practical questions around things like with localized estrogen, how long can you use that for? People have been asking.
So ideally you should use vaginal if you need it, as in if you've got symptoms, that is something you're going to need to take lifelong, because when you stop it, you're going to have the same problems again. So I think there is something, and I think it's worth women knowing this, because sometimes what I will say is my GP gave me it for 3 months to see how I got on, and now I'm better and I've stopped it. I'm like that. Oh, that just doesn't make any rational sense. So if you're going to use vaginal estrogens, often what we might do is we might front load people. So we might say, right, use it every day for a month, or every 6 weeks. We might double it up to begin with to get on top of some of the symptoms. And then it might be something, particularly if you're using pessaries, you might use them twice a week. You might use pessaries internally, and you might use estrogen cream externally. But it's something that if you've got this issue, that it's not going to get better with time, and it will come back when you stop the treatment. So there's something about understanding that this is a lifelong commitment to your vaginal health.
Okay, and on the same note, someone's asked around the moisturizers, whether that's something you'd use before sex, or would it be part of your daily routine, or a mixture of both?
So there are two different aspects. There's one about moisturizing, which is kind of proactive, and then there's lubrication. So we might have problems with both of those things. So some people may only not necessarily notice vaginal dryness that gives them a problem day to day, but they maybe don't lubricate on arousal the same as they did before. So when they try to have intercourse, even although they may feel quite aroused, nothing's happening downstairs. So in those kind of circumstances, then you want to look for a good quality lubricant, so that you're wanting to use lubricant when you're wanting to have vaginal intercourse. But moisturizers are something that you use all the time to keep the environment of the vagina healthy, because what we do know is when we experience vaginal dryness, it changes the acidity, so the pH of our vagina changes, and that also changes the types of bugs that live in our vagina. So the types of bugs that live in your vagina after menopause are different to the types of bugs that live in your vagina before the menopause, and that has an impact. That's some of these impacts around why we end up with urinary tract infections, because the environment becomes much more like the gut and like the bowel. So the same bugs that grow in our bowel that give us urinary tract infections begin to start growing in the vagina. So that's why we have this increased risk of getting urinary tract infections after the menopause also. So the moisturizers are designed to keep the pH similarly to how it would have been premenopausal, and that also changes the flora that the bacteria that grow there and all the rest of it. So the vaginal moisturizers are a different thing to lubricant, and I would suggest that you need them both.
Okay, and in terms of using a moisturizer and localized estrogen, would you need both of those?
You can. You don't necessarily have to. Often what women will find is if they don't want to use hormones at all and they try moisturizers and that works for them, that's fine. What that isn't, that is going to deal with moisture and dryness. What it isn't going to deal with is this loss of tissue, because there's nothing estrogen within the moisturizers. So some people will use both of them. So you might use them on alternate days. The days that you're not using vaginal estrogens, you might use moisturizers. Some women might start with moisturizers and see if that's enough to keep their symptoms at bay, and then move on to estrogen if that's the way they want to go. Some women might start directly with estrogen. I noticed, I think there was a question flashed up there with somebody saying that they'd had a hormone sensitive breast cancer. So I'm a breast cancer oncologist. That I do that as part of my day job, if you like, in addition to this work. And again, it would be a conversation with your oncologist or your GP around whether you wanted to use vaginal estrogens. I will, on occasion, prescribe vaginal estrogens for people who've had hormone-sensitive breast cancers if the other things haven't worked for them, because we know that the absorption of that is relatively small. But again, that's quite a specific question. That person who asked it, I would suggest that you have a conversation with your oncologist around that.
Yeah, and on that, yeah, because someone was asking around the risks that come with localized estrogen compared to the risks of taking.
Yeah. So we know that there is no increased risk of breast cancer with vaginal estrogens alone. We know, and I mentioned there that the amount that we absorb into our body is relatively low. The estimates are that using vaginal estrogen cream is about the same as over a year is about the same as taking one HRT tablet. So that gives you a sense. It's a very, very low absorption. We're not saying there's none, but it's actually relatively low. And we know from the big studies that there's no increased risk of breast cancer in relation to vaginal estrogens only.
Fantastic, thank you. And someone asked whether local HRT will cause periods to return, because obviously when we take people taking cyclical HRT, that can sometimes bring about having a monthly cycle. I'm just wondering, people.
So the local vaginal estrogens on their own don't cause a resumption of bleeding, although you can have some small bleeding and spotting, particularly if the surface of the vagina is resurfacing, if you know what I mean. So you can have small bleeding, but it doesn't cause monthly bleeds or cycles, and cause your cycles to return.
Okay, brilliant. And so I was also asked around how the Mirena coil could impact on vaginal issues.
Yeah, so the Mirena coil is providing the progesterone part of the HRT. So it's providing the part that's protecting the lining of the womb from the act of estrogen. So most women don't have any problem in related to, but the Mirena itself doesn't contain any estrogen. So the Mirena itself just contains a very small amount of a synthetic progesterone that's protecting the lining of the womb. But you can lose local estrogens alongside that if you're having estrogen-related problems with regards to vaginal atrophy. So the Mirena is not a replacement for.
And do you find people who've had the Mirena coil, so me using that for contraception, does that tend to exacerbate any vaginal symptoms? Does that cause any issues for people, or is
not as far as we know? I don't think so. It's not. Yeah, the Mirena itself is not going to. The main vaginal symptoms are in relation to loss of estrogen. Yeah. The Mirena doesn't contribute to that. The Mirena doesn't either add estrogen or take it away. It's just providing the progesterone part of the HRT. So yeah, it's not something that I've come across in terms of women saying, I've got a Mirena, therefore I've got increased vaginal problems. That's not something I've experienced.
Okay. And someone's asked whether there's such a thing as a female Viagra.
Well, yes and no, in that there have been many treatments tried for what's called female sexual dysfunction, which is such a hideous term, because actually when they do scientific surveys of women, there's something around 40 to 50% of women report sexual dysfunction. I'm going, well, 50% of people are experiencing it, then that's not a dysfunction, that's normal, surely. And part of the issue that we have, I think, is around a lot of the ways in which we look at female sexuality are based on male light sexuality, and they're just completely different things. And we know a lot of that now around arousal, libido, how things work, that we've always assumed it should follow this particular pattern. Well, it follows this particular pattern if you look at this subset of people who have penises, but actually what we know now about female arousal, etc., is quite different. So the fact that we've never found a pill that makes a difference for women's female arousal tells us a lot about the very many different things that interplay into what it's like to experience arousal, feel sexual, all of those kind of things. So many things have been tried, very few have worked, because it's not about something external out there making us feel a certain way. It's about how do we want to feel, and how do we, and most of us have never been taught how to do that. That's the other thing. Many people of our age have had fairly substandard sex education. So there's things out there as well about understanding that maybe we could learn. You know, there are plenty of ways out there to learn about how your body works. Practice so that you know how your body works and what your body likes.
Fantastic. Okay. And there's somebody, quite a few, asking around the vaginal moisturizers, kind of whether there's any particular ones you recommend, or suggestions. Someone said that they found they're quite liquid, and whether there are any suggestions for kind of pethary type things, or just anything that people should be looking out for if they're wanting to explore that. So
there are different ways of doing it, different types of doing it. Most of them contain hyaluronic acid, which most of us will also know from facial moisturizer. So that's a compound that causes moisture to be retained. So basically what you're doing is you're putting in a gel almost into the vagina that causes water to be retained in the tissues. That's really what it is. And there are numbers that you can get. You can buy them, but you can get them on prescription. So Silk is available on prescription. Replens is available on prescription. Yes, vaginal moisturizer is also available on prescription. So all of those compounds have all of those products have something quite similar in them with regards to being a long-acting moisturizer. As I say, there are other ways you can do it as well. You can moisturize daily with coconut oil, anything you can eat, you know, any edible oil, coconut oil, olive oil, things like that. If people want to do that, they're perhaps more useful on the outside, so kind of in the labia and on the outside either, rather than necessarily using them internally, although some people do. But certainly there are plenty of things available on prescription if people want to try them, or you can buy all of those. You can buy Silk, you can buy Replens, you can buy Yes over the counter.
And someone also asked around the losing of sensation. Is that very much, that's the estrogen part that's driving that?
Yeah, that's usually. There's a combination of things in that, like any part of our body, it is also a use it or lose it phenomenon. So as we were saying earlier, if you're not exercising your biceps at the gym, then you're not exercising your biceps at the gym and they're wasting away. So because this is erectile tissue, so what that means is it is muscular tissue that swells with blood when we become aroused. There is also something about, and just the way that our nerves age with time. So we are losing sensation in all sorts of, or losing nerve function, if you like, in many parts of our body as we begin to age. And if we're not using it, then that atrophy process is speeded up. So there is also something about realizing, maybe noticing that you don't have sensation. Well, what are you going to do to it? What might you try to enhance sensation, to use sensation? But what I find is people become very disheartened at that point. So they realize they've got no sensation. They're worried about it. Worry is the biggest passion killer imaginable. So the minute we have anxiety and we're worried about something, we've switched on a system within our body that automatically switches off our sexual response system. So that's why it's very difficult for us to do arousal and worry at the same time. Those two things can't be switched on at the same time. And so it then becomes a little bit of a self-perpetuating cycle. That's sometimes why you might need to see somebody who can help you work through some of that, because we need to try to interrupt that cycle. So the ways that people can think about in terms of sensation, you can use lubricants, for example, that might be minty or tingly, or all those different types of things within them that might help in relation to bringing an element of sensation back. You might choose to try some different or new types of sex toys or techniques or something like that, to just get a sense of what does it feel like now. Yeah. And because what I tend to see is people become more and more shut down because they become more and more disheartened, when actually it's at the very time where we need to maybe just find a little bit of something to make us move forward, if that's what we want. For many people, they might be quite happy, and that's okay. It's not about, at this point in our lives, it's not about you should be doing this or you should be doing that. If you're quite happy, that's okay.
Fantastic.
Absolutely okay.
That's okay too.
It's such a lovely comment just to finish with here, just saying, from one of the audience, just saying, thank you so much for sound, sensible and helpful information. It's so empowering to have such a grown-up, informed conversation about this. I don't think I've ever felt so valued and respected as a woman.
Oh, brilliant. And that's what we need to feel sexy. It's not about that. That's what we need. That's what we need to feel sexy, is an understanding that it's okay to be who you are. If you want to learn, there are things to learn, and you can simply play with it. So a lot of what I do is around play, exploration. There is no shoulds here. You have a body, it is capable of amazing things. Just allow yourself, just allow that possibility.
Fantastic, thank you.
Thank you very much, Sally, for answering all of those or putting those questions to Claire. And there's so many questions in there. Just a quick recap. Yes, Vagisan is very good. And one of those products that Claire mentioned earlier is very organic, which was silk, I think, wasn't it? So we don't do advertising on Henpicked,
Yeah, no,
but
of course.
I will make some links available so people can find them when we share this link afterwards. And yeah, I absolutely agree. Great session, probably one of the best yet I've just seen there. So thank you very much, Dr. Macaulay. Wonderful session. Great to see you again. And thank you to everybody who's joined us. We look forward to talking again soon, and have a wonderful week. Thank you very much. Bye.